Yay.
Yay.
So excited.
So excited.
So I'm Misty.
I'm Amber.
And we are the Invisible Diaries. So we are a podcast show, community, whatever, or however we're going to introduce it. Basically, we're shedding light on invisible illnesses through community support, education, and advocacy.
Absolutely.
So,
we're basically wanting to be the thing that when we first got diagnosed and we went on the internet and we couldn't find anything, that's what we want to be.
Yeah, just like support, friendships, advice, all this stuff, because you don't learn any of that from doctors, like,
or Google.
Yeah. So we're going to introduce our stories and why this came about, and we'll probably be a mess because we're just kind of winging it.
It's our practice run. Yeah.
Practicing, and we might post this, we might not, and we'll see what happens. And I also want to point out my dead plant, and it's a cactus, so it shouldn't be dead, but we'll just give you a little information about me.
Love it.
So yeah, do you want to go ahead and introduce yourself first?
Sure. Okay. My name is Amber. My name is Amber, and I'm 36. I'll be 37 this year, I think.
Oh, we gotta say our age.
You don't have to, but keeping it real.
Keeping it real. If you hear my stomach, my bad.
Growling? Are you hungry?
No, just
Taco Tuesday. Or is it a spoonie problem?
My stomach just like ADD. Okay.
So I was diagnosed with my first autoimmune disease 9 years ago. It was interstitial cystitis, and it was a hot mess to get there. I feel really lucky because from the time my symptoms started in 2009 to the time I got a diagnosis was under a year, which is unheard of.
Oh, wow.
And it was by fluke, because I was having, basically, I had an ovary rupture due to PCOS.
Ooh. And
almost died from sepsis because they turned me away twice in the ER.
Oh.
So when it ruptured, I was bleeding internally, and thankfully was staying with my mom, and she ended up taking me to a walk-in clinic, and he referred me to another friend of his, like literally walked me over to his friend who had admitting privileges. He looked at me, was going to do a exam, and he's like, "You're too sick. You just need to, I'm admitting you. You're not even my patient. I'm admitting you."
Good.
So got admitted, was supposed to be like a quick procedure laparoscopically. Basically my body shut down. And so I ended up being in the hospital for a week. IV infusions for iron because I was like on death's door, really, really sick. And the doctors were kind of like, "We don't know why you're so sick. Like, this should have been, like, yes, the ovary, the cyst ruptured, and yes, you were bleeding internally, but like, this should have been like a pretty quick fix."
Yeah.
So, got, out of the hospital and was feeling great after feeling so terrible. And then probably within like 4 months, I was still having a lot of like residual pain, which I thought was just from the catheter. Every time I would go to the bathroom, like the urgency was really quick. And I was just like, do I have a UTI? Do I not have a UTI? Like, I didn't know what was going on. Kept going to the doctor. Doctor's like, "No, you don't have a UTI, but there's blood in your urine." I was like, "Okay, what does that mean?" Referred me to the urologist. Saw one of the best in this county. He's like world renowned. Put me through all kinds of crazy tests to tell me that I was an anomaly, and that basically my bladder walls were bleeding. But normally people that have like a spastic bladder, normally people that have that can't hold a lot of urine. So to put it into perspective, I hadn't really connected the two between my hospital stay and what was going on with my bladder, except for when I came out of surgery, I had a lot of abdominal pain. And this, to me, is part of the reason that I want to go into nursing, because I had such a poor experience. I love our nurses. This is not against nurses.
Yeah, it's
this was an isolated incident, but basically came out of surgery in the middle of the night, like came out of recovery and was having a lot of abdominal pain, and the nurse basically threw the box of tissues at me and was like, You just had surgery. You
Wow.
just need a good cry. Like, you're just coming out of the anesthesia.
Yeah, because
And I was
they're
like,
hysterical.
right. Like, you're so
Hysteria.
disoriented. And I was just like, I
Wow.
remember being like crying and being like, I just want my mom. Like, like something's wrong. This isn't like surgery pain. Like, this is different. And so the next, so another nurse came in, because I was just like, why are you being so mean to me? Like, I didn't
Oh,
understand. I was in so much pain. The other nurse was like, has she gone to the bathroom? And I'm going, no, I haven't gone to the bathroom. Like, I just woke up. And so they did another catheter right there bedside. I had almost 1,000 cc's of urine. So to put it in
wow.
perspective, the normal bladder holds anywhere between 150 and 200 cc's. So mine literally almost ruptured. So it
Wow.
overdilated. Didn't think anything of it. Like, it was so, because it was in that twilight, like
Yeah.
after anesthesia. So I didn't think
That
anything
could
of
have
it.
been
So
horrible.
yeah. So
I don't even know how you,
the floor nurse came in
what
the next day,
happens if
like,
that happens.
like long story short, like, they were super great. They took care of it, like, totally isolated incident. But fast
Wow.
forward, when I saw the urologist, and he's like, you're an anomaly because basically your bladder walls are bleeding and they're spastic. Um, so there's one approved medication for this. I'd love for you to be a case study, and let's do a pacemaker for your bladder. And I remember
Wow.
being like in my 20s, and I'm like, wait, what? Like, a pacemaker? I've never even heard of such a thing. Like, I've heard of a pacemaker for a heart, but like bladder. So
Wow.
I went and saw my OBGYN, and she was like, okay, hold up. She's like, I think I've looked at the notes, everything that he's saying, I think it's interstitial cystitis. She's like, we can start with diet. And she's like,
Yeah.
get off that medication, because Elmeron, which I know helps a lot of people, but for me, I am very, I have issues with my sympathetic. So I run hot all the time.
Yeah.
If I'm not hot, I'm frozen. And so the Elmeron, it creates an issue with being able to regulate heat. Like, you tend to run warm. We
Oh,
live in
wow.
Florida. It's hot here all the time. Um,
Yeah.
so
And
I,
those
so
all
I,
have so many side effects too.
oh, like, and I didn't mind. Like, at that point, I was in so much pain. Like, I was like, I'll do whatever. Like, just tell me how to fix it and I'll do it. But she was like, there's no research. She's like, of course he wants you to be a case study. Like, there's no research on this stuff for your age group. Like, what if you want to have another
Oh.
baby? Like, you're still in reproductive like years. She's like, no. She's like, we don't even know.
That's
She's like, your
why it's
body
so important to get
rejected.
a second opinion
Oh my gosh. Like, and it
or
was
third.
one, and you're so desperate when you've been feeling so poorly for so long. Like, you're like,
Mhm.
I'll do anything to feel better. So, like, just tell me how to fix it. And I just remember looking at her and being like, what? Like, I don't like diet. So she hands me a pamphlet, never even heard of interstitial cystitis. She's like, go home, look it up, and then see me in a couple of days because you're
Oh,
going to be
wow.
overwhelmed. And I
I
was.
like that because
So that
that's
actually
nice that she
started
kind of
my,
expects you to look it up and research it, you know. That's cool.
she was awesome because she's like, I know you're going to have a lot of questions. She's like, and I know you're thinking of them all right now. So she's like, so go home and process, here's all the literature, and then let me know when you have questions. And so that's what I did. And thankfully, I ended up seeing a functional medicine doctor after that, because it was overwhelming, because I was still
Yeah.
like, I mean, I was basically peeing blood all the time, which
Wow.
some of the treatments that they do for ice, I mean, there are women that get
They
Botox
sound
injections, like bladder
crazy.
installations,
Yeah.
like it's
I feel
intense.
like it's
It's intense,
kind of
but
common. I'm hearing a lot more about it
it's
lately.
kind of,
Younger women.
well, that's the weird part. Like, back in the 60s, women used to be institutionalized for
Hmm.
IC. So, because it would literally, I mean, they couldn't, and there's still a lot of stigma, I guess, around it, because of the fact that there's no definitive way of onset. So it's like, some women, it's childbirth that sets it off. Some women, it's being in the
Oh,
hospital and having a catheter inserted. I mean, like, there's so many, some people, it's trauma. Like, they, hit their bike really hard, fell off a bike. Like, there's all kinds of
yeah.
ways. So because there's no definitive way to necessarily say this is how you got it, there's a lot
It's because there's
of
not enough
doctors and friends that don't
information.
acknowledge.
That's why I want
Yeah,
to do
which
this,
is crazy to me, because there are so many people like on, well, and like the Facebook support group, like it's crazy to me that there's like one main approved medication. I mean, this has been 9 years, so there's been some stuff, but like there's still so many physicians that are like, what's IC? Like, I have no idea what that is. I'm like,
Yeah.
what? How do you not know what that is? Like, it, to me, it's as common now as like POTS, but like it's not. I don't know.
And that's
So
why
anyway,
I think
that's
we're
what's
here doing this, because
right.
these little things that people are going through, suffering through, dealing with their whole lives, not getting answers, not getting diagnosis, being told it's in their head, whatever. I mean, I could go on and on and
Right.
on. And they're not getting
Absolutely.
help. They're being neglected medically, you know. So, you know, I think that's kind of why we're here for this, is because, you know, these
Absolutely.
are invisible illnesses and we want to shed light and raise awareness, because if not, you
Right.
know, then there's going to be still doctors out there and, you know, staff that aren't going to understand it. So if we can help them to understand and help people to not feel alone, you know, then we're
Right.
doing our thing.
Well, that to me like is the biggest passion behind going back to school and all of the things that you and I are both on the same page about, you know, being a health coach. Like for me, it was about being like bridging the gap. So it's like, even when I think of like older patients, not just people with autoimmune disease, it's overwhelming. Like your doctors have
Yeah.
5 minutes with you. Like you're supposed to fit like all of everything that's wrong with you in like 5 minutes, and it's near
Yeah.
impossible. So it's like, I think, you
Oh
know,
yeah.
part of what we want to do is help people understand like getting a game plan together, making the most of that time with your physician, and then getting them to hear, you know, what it is that you need and what's going on with you.
Yeah. And
What about you?
for me, mine goes on forever. You know, I guess just I'll start with saying, like, the best thing I did for myself was to save all of my records and to go get them. You know, I'm
Right.
shocked when I hear people, because a lot of people come to me for advice, and you know, I'm shocked when I tell people, like, go get your records, and they're like, I can do
Right.
that. I'm like, yes.
Mm-hmm. Yeah.
A lot of times we don't realize that we have rights, and our rights are to
Mm-hmm.
access those. And so, you know, basically
In a timely
any,
manner, no doubt.
oh yeah. And
Yeah.
so usually 24 to 48 hours, you know, after you have a test,
Mm-hmm.
say you go to the hospital, we get an ultrasound or an x-ray, or an ER, you can go to that building, whether it's the hospital or,
Mm-hmm.
you know, clinic, and you go to the medical records department. There's a little office. There's usually no windows,
Yeah.
and you ask for your records, and they will print them out and give them to you.
Yep.
And so that's kind of how I started, just by kind of collecting. I got a huge stack, and
Okay.
you know, I'm able to go through everything. A lot of things get missed. So, for example, I have a lot of heart issues, which I'll get into in a second. Um, but I had my carotid ultrasound, so they did an ultrasound on the carotid, um, and they saw I had little thyroid tumors.
Right.
Didn't say anything, so the report said, you know, to my cardiologist, carotid looks great, but let the patient know we saw tumors on their thyroid. You know, like, I guess just being in the area.
Right.
So I get my record. I've read it, my report. I know what's going on. I see my doctor. I'm like, so how is everything?
Right.
And, you know, he's just like, everything's great. So doesn't even tell me, you know, doesn't even tell me.
It's
And that's,
insane.
you know, I could go on and on and on and on. I could write a book about, you know, how many times that has happened. And
Right.
so that's like a really big step. And then you're able to kind of eventually see little red flags, tell your doctor, like, hey, I noticed this. Why don't we look into that? Another
Right.
thing I found through my records that nobody told me was that I had little clips on my fallopian tubes, because that's what they do when they tie your tubes. And one had come off, and it was lodged
Right.
into my abdominal um, wall. And they saw that on like an x-ray or something. Nobody told me. So here I am, just like a free
That's the
fallopian tube
craziest to me.
and a piece of metal.
Free fallopian,
Yeah, just, and
just
it was
like
floating
lodged anywhere in
around.
your abdomen,
It was lodged in my bladder once. It was lodged into the, you know, it
which is
moved.
insane to me. Because if
Yeah.
your intestines tear, like you
Oh
go
yeah.
septic and you can die very quickly. Like that's mind
Well, I
boggling.
had the free fluid, and who knows if it was from that or whatever. I mean, I had a lot
Right.
of issues, but yeah, so no one told me, and I saw it, and I was like, oh, let's look into this, shall we? So I made an appointment with my doctor, and I was just like, can we get this thing out? And she, so we did, but that was because of me. So you really have to be like an advocate
Right.
for yourself. So a little about
Absolutely.
me. Did we introduce? No, we did introduce ourselves. Okay, so I'm Misty.
We'll get
We
it.
have lots of brain farts. I am 34. I'll be 35 in August. I was born with a congenital heart defect called Wolff Parkinson White syndrome, that nobody knew about until I was in middle school, like almost 15.
Oh, so you didn't get diagnosed as a child?
No, because my heart
Oh,
would go into like the 250s, 350s, like not kidding. I'd had
insane.
SVT, supraventricular tachycardia, and that was like normal for me. And being like, say fourth grade on the softball team running laps, I'd be like, my heart is racing. They're like, that's normal, you're running, keep it up, good job. And
It's got
I'd go up to like
exercise.
my aunt at Christmas, and I'm like, hey, my heart's racing, and they're just like, yeah, okay, yeah, that's normal, you're running around, you hyper animal, like. And so
Right, right.
I always did poorly in um, gym class at school, so I wouldn't dress out. Junior high was like, I mean, I just, I'd sit out and get in trouble and bad grades for not
Right.
participating. And when I did, my face would just get red, but it'd be white around my lips and like my nose and eyes, and like the coloring would be off, and I would just not feel well. And just so I'd be like, all right, I got to go to the nurse again. I'm not feeling well. And one time, I think I was like 14 maybe, the nurse was like, oh, okay, Misty's back. And they listened. She was like, I can't count your pulse. Oh my God, called 911, called my parents. By the time I got to the ER or hospital or whatever, it had converted, because it would just be like normal, like do do do, and then convert like back. And
Wow.
so they always missed it, and so they advised like, okay, when it does that, go to the ER, let's catch it. And so we tried that
Right.
for a couple of months, and it would just be like, oh, everything sounds perfect, you crazy person. And
Right.
so I think we finally got in with a cardiologist. And again, I think at this point I was about 15. I wore a heart
Right.
monitor, and just by the time I got home, sometimes it would be triggered if I'd bend over to like pick something up. So I dropped something, picked it up, and there it went. And I was like, oh, here it is. So it's recording, and then you go and you put the monitor on your phone, send it through to the doctor. The doctor called back right away. That's SVT. And so we figured it out at 15. And then they said,
Crazy.
you'll outgrow this. So I was like, okay, I've all right. So I suffered with that for a long time. I at some point even got diagnosed with POTS and inappropriate sinus tachycardia. Um, at 19, I said, listen, I am not outgrowing this. It is getting worse. Like if I just go, take a deep breath, it'll go into the rhythm. Like it was like 50 times a
Right.
day, just nonstop. And if it wasn't in
Wow.
SVT, if I would be sitting down, it'd be like 50, and I'd stand up, it would jump to 150. And I was like, look, it's not going away. So
Yeah.
at 19, I did my first ablation, and 6 hours later, the doctor's like, that was the longest one I've ever done in my life.
Wow.
He was like, it's in a rare spot. That's when they diagnosed the WPW, which is an extra bypass pathway, like in the middle of your heart, that's throwing these rhythms. And then they're like, we can try again in 6 weeks, but we just want to give you, the risks and let you heal and blah blah blah. So tried
Right.
it again in 6 weeks, still a bust, another max time, still unsuccessful. And then he left. He totally just left. Like, didn't even tell me he was gonna relocate or anything. Like, I don't
He's like,
know.
maybe I'll lose her
He
along
he
the
just
way.
left. I was
That's
like, hey, where's my
crazy.
follow up? Oh, he's not here. It was crazy. And so they think he possibly put a hole in my aortic valve. but it could
Oh
also
no.
be that I have, with my valve issues, I have issues anyway. They all leak.
Right.
It could have been that. So I had a hole in my aortic valve for 7 years. Um, Again, I got a new doctor. I had two more ablations, years later. And because when I go to the ER, I was like, I'm not feeling well. They were just like, yeah, you're not having SVT. And I was like, yeah, I know. I'm here because I have this chest
Some,
discomfort and this and that.
yeah.
I'm short of breath. Yeah, well, your rhythm's good. And they'd send me home. And so, that went on for years. And finally, another doctor, another visit, just like, okay, well, I hear your murmur, but everything sounds fine. I was like, wait, I don't have a murmur. No one's ever told me that before.
Right.
And so he was like, all right, well, we'll do an echo. And then that's when they discovered I had severe aortic insufficiency. And no doctors wanted to touch me. They were, I saw so many, and they were like, yeah, you need surgery, but you're young, there's risks. And so um, I joined an online support group, found my doctor, and he was ready. And so we went in there, he repaired it. Um, and so that went well, but that was in
Right. Right.
2011. And so now, like, all my valves leak again. Um, my aortic root's dilating. I have a pacemaker now too. That happened 2 years ago. So it's been, I could go on and on about all of that stuff.
Right.
But throughout my heart journey, um, I kind of asked a couple doctors, like, why do I have all these issues? Like, this isn't normal. Like, there's got to be like an underlying condition. Cats. um, Sorry. I'm like, there, like, nobody wanted to investigate that, and it drove me crazy because I was, at one point I was like, well, I have kids. Is this gonna be, is this something that's hereditary? No.
Right.
And they would tell me no. And so I never worried about my kids having the issue because I was always told not to.
Right.
And then after doing research and then getting some genetic testing done, I discovered that I have Ehlers-Danlos syndrome. And so when I discovered that, I was like, crap, that
Right.
is something you can inherit, that is hereditary, so, or can be. And and then I realized, like, they showed a lot of the signs. And I took them to the pediatrician. They got the genetic testing. They saw the cardiologist. They have mitral valve prolapse. They have POTS. Just this whole time, like, I just never knew because I trusted my doctors. And so here we are, and now I know my kids have it, and so now I can. Oh, the phone fell. Now my kids can get the treatment that they need at
Right.
a
They can
younger
get ahead of
age.
it.
Luckily, they don't have SVT or any of that issue, but they do have POTS. And because I never really I paid attention, but I didn't, like, think that, like, with my daughter, with Astrid, for example, like, her dad just thought, like, oh, she has anxiety, I think. And I was like,
Right.
well, she can be emotional, and that makes sense. She has anxiety. And
Which, by the way, guys, on a side note, we're gonna do a whole episode on pediatric because
oh,
we
yeah.
both have kids that suffer from these things, and mine's actually getting ready to get tested for EDS.
Yes.
So yeah, so like we're definitely gonna do a whole segment
We're
on
going
this
to have a
because I think
lot
it's,
of
yeah,
topics.
it's really, really, really important to get ahead of it when they're young because so much is brushed
Yeah.
off as hormonal. And not to say that it's everything, of course, is
Mm-hmm.
autoimmune, but these kids, there's a lot more suffering in their generation. So yeah,
Yeah.
which there's
And I'm a good example of that
that's
too.
a
I
whole
mean, yeah, I went through my whole childhood without being listened to. And sometimes
right,
kids don't have the voice, or they don't
the
know
vocabulary, yeah.
any different,
Well,
you know?
navigating childhood, like navigating your, childhood and your teenage years is like difficult
Yeah,
just with normal like issues, let alone like health issues that you can't articulate. Like,
right.
I don't know why I'm so tired. Oh, you're growing. Okay, how
Yep.
long do I
Growing
grow?
pains. Oh, I had them forever. I still do.
Mm, yeah, yeah,
um, so yeah, so, you know, we sort of thought, okay, that maybe she's having anxiety, and that didn't settle right with me.
Right.
I just, it wasn't like my gut feeling that made sense. And so there was one day where she was having an episode where her heart was racing. She felt like she was having an anxiety attack.
Mm-hmm.
Her headache, nausea, and just like and so I was like, well, I've been monitoring my blood pressure and all that stuff throughout, over the last few years. So I was like, sit down, Dr. Mom's here.
Right.
I took her blood pressure. I put the pulse oximeter on. Her BP was like 74 over 39.
And how old
It
is
was
she?
like, this was just last year.
Oh my
Her heart rate
gracious.
was 12. Her heart rate was like 130, and I was like, oh my god,
Right.
this is
Right.
what's going on. This is an anxiety. She's having an episode. So once I realized, like, okay, I had her elevate her feet. I gave her water and some salty snacks, and she was feeling better in no time. But and we just keep on top of it now. But for me as
Right.
a kid, I always avoided salt because of my heart, and thinking like,
Mm-hmm.
you're not allowed to have salt with your heart. And I never drank enough water. I just didn't, the whole self care that was like non existent.
Right.
And I just ran my body down while, just not having the education,
Right.
not having doctors who cared enough to find out what was going on with me. All the puzzle pieces were there. I've always had stomach issues. I have sleep apnea,
Mm-hmm.
um, POTS, all the heart issues, the hypermobility.
Right.
I've always been sick, throughout my whole life, and it's it's it sucks, but at the same time, it's like bittersweet or nice to have that validation that like, hey,
Right.
it's not in your head. There's actually something going on with you.
Well, and that's the interesting part. And I'd be curious if we run, whether we do an Instagram poll or something down the road, but like I was always sick as a kid, like so
Mm-hmm.
much so that they'd like give me like 100 tablets of penicillin at a time, because like if the wind changed, I'd have
Wow.
strep throat again, like
Oh
all the time. Like,
yes.
and it was like, and like I remember being like I'm just sick all the time, like I'm just sickly, right? Like, so it's like, but
Yeah.
I, because of my personality, like it didn't like take me out for too long. So
Yeah.
even like when I got the stomach flu, or like, and I'd be down for a few days like in bed, because when it hit me hard, then I was like right back up. And so
Yeah.
I'd be curious to see how many people with autoimmune diseases that got diagnosed a little later had
Mm-hmm.
really like hardcore, because we all remember like the amoxicillin pink bubble gum in the refrigerator.
Yeah.
like,
Oh my
like
gosh.
you know what I mean? Like, so I'm curious, because it seems to be a consensus. And like, even like with me, like hyperhidrosis, I've had that,
Mm-hmm.
that's hereditary, right? So it's also very, very common with dysautonomia. And it's something
Mm-hmm.
I passed along to my son. So it's, but but as a kid, it's like, oh, you just have sweaty hands and feet. It's like, yeah, okay, but why are they like so bad to the point they're like dripping? Like, that's not
Yeah.
normal.
And the other thing is too is sometimes people see like a an issue like that, and they'll just say, okay, that's what it is, and they're done. Case
Right.
closed.
Right. Like,
And
oh,
it's
it's just
crazy
hyperhidrosis, no big deal. And
because,
it's
like, when you have something like Ehlers-Danlos syndrome, you have your little umbrella, Ehlers-Danlos syndrome, all the
yeah,
millions of raindrops. You have Raynaud's, POTS,
right.
gastroparesis. The
Yeah,
list goes on and on. So when people
right.
just look at the one thing, like, okay, Misty has these heart issues, and that's what they focus on, and it's like, no, I also have severe debilitating migraines where I'm like tripping balls and have
Right. Right.
flashing lights, and I have so many sensitivities, and as a kid, I remember like in high school when I started having like friends and stuff, like hanging
Right.
out, I had the flu like every month. And I just said I had the flu, but it wasn't really the flu. I get a fever, and I used to just joke and just say, "Oh, my body's forcing me to rest."
Rest.
And that's what happened. My body would just shut down, and I would be in
Yeah.
bed. And there was one time I was about like 16 or 17.
Mm-hmm.
My legs just went out. I couldn't feel them. They were like
Right.
numb. I couldn't
Right.
move them. And then it was like a whole week where I had another day I had slept 21 hours and I slept a whole 18 hours. And I remember going to my doctor and, I'm 5'10", and back then I was tiny. Like I was, no more than a 3. Like I was like a 0 to a 3
Right.
at that age. Like I threw a celebration when I made it to size 0. And so like when I went to the doctor, this doctor, by the way, I'll tell you his name later, is no longer in practice. But I went to the doctor, didn't even look at me, and he's just like, "Oh, you probably just need to lose some weight," and like made a comment about my weight, gave me
As a teenager?
Yeah, gave me some type of pills for that. And I remember he gave me some type of tablet. It like you put it under your tongue or in your mouth and it dissolves, and it was supposed to like help you sleep or something. And I don't even know what it was, and it was just like it was just all
crazy.
BS, and
right.
Just not even eye contact, didn't even ask my history, and it was like, like my legs like were not working for a whole day, like they were numb,
Right.
I would just have these really bizarre things
symptoms. Yeah.
that happened.
And that's the crazy thing too, is that it's like I was the same way. So like growing up and doing theater and dance and stuff, and I always had like sports, I always had knee pain, and like, oh yay, mascot.
I have a pillow back here to prop this up.
The things we do for the right angle.
I know. So otherwise we get.
Yeah, that's what I'm dealing with right now because I'm so swollen. But yeah, like I remember, like, I mean, like, of course, all through tech week, when you push yourself and you're pushing yourself and it's like, stress. I got sick, and it was the running joke. Like every opening weekend I would have a cold, because I would just be like, and same thing, like you're like, oh, your body's forcing you to be like, and we're done.
Your body can't, because it's like with
right.
the spoons. We
right.
only had a certain amount of spoons in, but we
right.
didn't freaking know.
Right,
so when we
exactly.
ran out, our body was like, you're negative, you're down
right.
today.
Well, and that's the thing. And like I would run super high fevers, and like it was weird because I run low anyway. I don't know. I think you're the same way. Don't you run lower for your temperature too? Body base temp?
I don't get very high fevers. I run low, but I do get
right.
low grade fevers too.
Yeah.
For no
like,
reason.
Yeah, because like my base temp is like 96.8 to 97.2. I mean, like it's really low. And so, but I remember like at 16 going to the doctor and him being like, you've got arthritis in your knees. And I remember being like, okay, so that's why I have pain. Like I have arthritis in my knees. Not even questioning like I would now. I'd be like, why do I have arthritis at 16? Like, and so I was getting cortisone injections to get through performances and to get through dance. And I would never put that stuff in my body now at the rate I was putting it in, because I just needed to get through the next show or the next, because the inflammation was so bad. And now, of course, now that I know that I've got fibromyalgia and I've got, diseases that create inflammation, I, of course, look at inflammation completely different. Like inflammation is telling me what's going on. Whereas then it was like, oh, I've got arthritis at 16. Like that's normal, right?
Yeah. And that's what bothers me, is I feel like these doctors or healthcare providers, they need to find out why. Like why
yeah, like functional medicine. Get to the root.
There was a girl on Facebook a while back who started having seizures out of nowhere, and it was just like, oh, they just said I have seizures and they gave me this medication and this is my life now. And I was like, well, but like but
why are you having
find
seizures?
out why. Like you don't just randomly start having them out of the blue.
Right.
I mean, for me, it's like once I figured out, like, okay, I have this genetic thing going on, then it's like that was my why. And I was like, it's nice and to know, what's going on, and so you can figure out like what you can do to manage it or alleviate it, or
even just knowing what all of your options can be, like for me it was like, and this is again was a long time ago, but like, you go to your GP and your GP's like, yeah, you have arthritis in your knees, and so we're going to do cortisone shots. Like case closed, that's the only thing. And then you move on, and then you're like,
yes,
I mean, like closed. Now if it was my child, like I'm like, wait, like before we do anything invasive, and I mean, not that shots are super invasive, but steroids at 16, it was like a band-aid over a check engine light, which I feel like happens a lot, where it's like, and especially like I never really understood what you used to talk about with like, oh, I see this specialist and then this specialist, until that happened to me this past year, where I was like,
Yeah.
oh, you're having heart issues, see the cardiologist. And it's like, but it's not my heart. Like,
Yeah.
you know, like, but then it's like, oh, but then the cardiologist sends me to electrophysiologist because we're still stuck on the heart thing. It's like, you know, the wizard behind the curtain,
Right.
where it's like you're looking over here, but something else is happening over here. And it's like, we got to get the connection, you know, pull the
Well,
curtain back and be like, this is
and the other
happening.
thing too, which I could go on and on about, is the whole anxiety thing. Um,
Right.
you know, dysautonomia isn't going to show up in blood work, and like
Right.
unless you're showing like major Ehlers-Danlos syndrome or whatever issue you have, that's like unless it's like super visible and obvious,
Right.
you're not going to get that in a basic blood work. So when I go to the ER having these episodes of dysautonomia where my heart rate is going out of control, um, you know, my blood pressure is going on, everything's out of control, you know, I know for me that I just need some fluids and to try to get
Right.
everything calm. Um, but like when they do my blood work, because I eat so healthy, I take supplements, I've learned to like make, you know, my health as good as it can get. And so,
Right.
you know, they're like, well, everything's perfect. So it's
It's
just in your head. You have
anxiety.
anxiety. Here's some drugs
You're
for you to
having a
get
panic
addicted
attack.
to. Have a nice day. And then they, you know, so, and sometimes they'll still do that. I had that recently. Um, and it's frustrating because it's like, you know, sometimes I'll have a good team and they'll listen and they're like, oh, okay,
Right.
yeah, she knows what she needs. Let's get her that. And we'll let
Right.
her go. But what I did find out, which is helpful too, is, you know, I don't want on my chart to show that I had anxiety, because next time I go there, they're going to just put me in a room, shut the door. They're not going to be checking my heart, because when my heart does this, sometimes I throw arrhythmias.
Right.
And I want that to be caught. I don't want to pass out, you know. And
Right.
so my last
Absolutely.
visit, I had an arrhythmia, an episode, but it was only like 5 seconds long, so it didn't get caught on my pacemaker.
Right.
Um, and so it was a bad one. So I went to the ER, and they were just like, um, they were not listening to me. First of all, the nurse had crazy strong perfume on, so I'm just like, oh great, this can make me feel worse. And
Right.
then I'm like, okay, I'm about to have an episode, because I felt that my stomach was upset, and it sometimes triggers it. And then I just got like
Right.
flush in my head, then a headache, and then I had this like nauseous feeling, and then it's
Right.
like my body just gets taken over with, and I just slowly, I'm like, okay, my heart rate's gonna go up, and it just goes woo, and then I'm like, take my blood pressure, it's gonna be high, and
Right.
then I'm like, go get them, because like when it sometimes it keeps
Catch it.
climbing, and that's when I get in the arrhythmia. So
Right.
the nurse was like, I was like, I feel like I might pass out, and the nurse was like, it's okay, you're laying down, like wouldn't even come in. My husband's like, you know, hey, come help, like, you
Right.
know, like
Like,
see what's going on.
and the big deal
And
about that is that you feel like you're dying.
oh
So
yeah,
it's the chicken and the egg thing. It's like with kids and like saying it's anxiety right away. Like it's like, yeah, but I learned this past year with my heart rate like getting the way that it was. It's like, and I kept going, like for me my go-to was, okay, am I anxious? Like I'm
yeah,
going through the process of it's, I don't go to the worst thing possible. But it's like, am I anxious because my heart is racing? Or, you know, is my
right,
heart racing because I'm anxious? And it's like, obviously in our cases with dysautonomia, like we're anxious because our heart is beating out of our chest and you
yeah.
feel like you're about to
I
die.
was just
Like,
trying to have a nice day that day. I was
yeah.
on my way to the grocery store, like
Like
I
not
was
really
like
wanting to hang out
looking
in the
nice.
ER.
I'm like, I was, you know,
This
I
is not
wasn't
the
anxious at
plan.
all either.
Right.
It was, you know, like it was a beautiful day, and you
But
know,
that feeling, like all of a sudden that onset of like nauseousness, and then like of course you take those environmental things of like heavy perfumes and, you know,
yeah,
that come off of all kinds of things and off gassing and whatever, adding to that disorientation, to me it's just like a perfect
yeah,
storm. And it's like, at like,
yeah,
you would think in the healthcare field that, especially someone saying, look, I might pass out, yes, you're in a bed, but you're a fall risk. Like
yeah.
if you go to try to get up when you're disoriented, you're gonna hit the floor. Like
But yeah,
I would
like
want to
I
know about
just
that as
got
a
there,
nurse or a
so I just
doctor.
got there for having those episodes, and it was like, you know, they just shut the door, but no, didn't even have me on the
Turn the
monitor and
lights
stuff
off.
yet. And so when she finally did, they were just like, well, we'll keep an eye from here. They didn't even want to come in. And then, so like when she finally came in, the episode was over. After everything calms down, my body just shakes. Like I'm
Right.
shaking like this. And she's like, are you having
Right.
a seizure? And I'm like, no, this happens after my episode. My
Right.
neurologist said it's like my circulation or something, like
Right.
it's, or part of the dysautonomia, I don't know, whatever, my crazy ass
Right. Right.
body. So I'm sitting there like trying, shaking, and then finally, like after everything calms down, it's just waiting for the next wave, at that
Right.
point. So they got my fluids going, fortunately. And so, later when it was time for me to go home, they just, that was it. They gave me my fluids and they're like, you're out. And they
Crazy.
they put anxiety on my paperwork. So I was like, Then like later I called the ER liaison, and I was like, look, that's not cool.
Yeah.
You put the wrong thing. I don't need to be going in there again, and
Right.
then they're just thinking I'm stressed out, having anxiety attack, and you guys
Right.
need to do you guys need to properly treat me. So
Right.
he was like, well, weren't you anxious? You're anxious anyway. I mean, everyone's anxious when they're in the ER. And I was like, do you give everyone an anxiety diagnosis?
Diagnosis. Yeah.
And I said, does anyone come in your ER that's not a little anxious? And he was like, oh, I'm sure everyone is a little bit.
Right.
And I'm like, right. And you don't
Sure.
just hand that diagnosis out.
Right.
So anyway, like I said, long story short, the proper way to go about that, if that happens to you, is you go to the medical records department, you ask for an amendment and have them
Right.
change it.
Yeah.
Which again is important because, yeah, sure, I was anxious, like it was scary,
Right.
but if they don't understand that I'm having dysautonomia, and my autonomic nervous system just going haywire,
Right.
like, I mean, oh my gosh, I would have loved to them have tested my like norepinephrine and
Right. Your
levels, like
cortisol
they
levels.
would have
Yeah.
been crazy.
Right.
But
Right.
they don't, again, the blood work that they're going to do in an ER visit like that is, my potassium, my magnesium, all that stuff's really
Right.
good. And so that's another part of the invisible illness, is that, in general, is that
It
they
hides.
aren't
Yeah.
always going to show up on blood work, and so they're, for
Right. Well, and
me,
a lot of
part of,
these diseases, yeah, no, a lot of these diseases you can't definitively
yeah,
test for anyway. So it's like,
right. And
it's a
so
process of elimination.
another part of why I want to be a nurse as well, we're both going to school, by the way, is I want to create, like, I want some, like, things set in,
Protocols, new
yes.
protocols.
So,
Yeah.
and one of them for me is, okay, if you're going to give someone the diagnosis of anxiety, like at an ER, for example, I think there should be some type of steps or protocol where you have to eliminate certain things and rule
Absolutely.
them out before you go there, because
Because
one in
anxiety is
20 people are misdiagnosed.
right.
That's 12 million a year. And
Right.
so that's dangerous. If you're going to
That's
send someone out with anxiety when really, like, maybe they were having an
right.
arrhythmia or something, and not to put panic or fear in people, but
And it's
it
not to take away from people that truly suffer from anxiety or panic
absolutely,
disorders, because those are very real, very scary. But that is a very different
it's just
physiological.
rule out other possibilities. That's
Absolutely.
it.
Yeah.
That's it.
No. Well, and it's like, I mean, it's what do we say in the autoimmunity community, which is basically the whole zebra philosophy.
Yeah.
It's insane to me that, for as long as medicine has been around, everyone forgets that it's still a practice. It's practicing
Right.
medicine. It is not a definitive. Every doctor is different because their experience, in the field is different. And, we're going back to school to be nurses because we want to help from the
Right.
inside out. You want to help educate. And I think every medical professional's goal is to be the very best medical professional they can be. And
Of
so
course. Yeah.
sometimes that's taking a step back and being like, this old model is not really working out for everybody, because everybody's different, everybody's body is
Yeah.
different.
And the other thing too, like if you go to an ER visit, I don't know if you knew this or not, but you're only allowed to like pick one issue.
Mm-hmm.
So, you know, like if I were to go in saying I'm having the worst headache of my life and I'm having a lot of palpitations, they're like, pick
Right.
one.
Yeah.
Um,
Which is crazy to me.
it is. And so I think that that's wrong because I think, again, you have all these puzzle pieces but they just only want to focus on the one at a time. And I think that they need to do better than that because
And
sometimes all of those, when you put them all together, you're getting a picture, you
right.
know?
Which I think goes back to changing the way general practitioners practice, which is why there's such a big movement in functional medicine because it's really about getting to the root problem. Because if you get to
Yeah.
the root problem, you can't just look at symptom treatment because symptoms, like we've even talked about today, like especially in this community, you could create a Venn diagram because they all overlap to the point where you're like, wait, I could have
Yeah.
20 different things, like because there's so many things that overlap with different,
Oh, it's so true.
syndromes, and
And that's
it's
why I feel
crazy.
like the whole hysteria in your head and anxiety thing is the reason I bring that up often is because um, you know, when you have all these crazy things that are going on with your body and so many symptoms, like
Right.
people don't believe you. They think you're crazy. They're like, oh, Munchausen, she has all these different things. It's
Right,
always
right,
something different, always changing up. I mean, I've had exes that called me a hypochondriac. I've had exes that are like, you're so negative, all you do is complain, you
right.
know. And so, in which another topic and episode I think will be spouses
Oh,
on our
for sure. How
spouses.
to deal with significant others, for sure.
Yeah, my husband's awesome and super supportive, and
Yeah, we're both very blessed
we
that
got
way.
lucky, but we definitely I know I have, you know, people in my past that were not. Um,
Yeah,
and
absolutely.
it's hard, you know, when you have loved ones that sit down and think like, you know, oh, maybe this is in your head or you're a
Well, and
hypochondriac.
these diseases and syndromes are so isolating as it is because
Mm-hmm.
of you feeling like a prisoner in your own body. I mean, I know for me, like when I'm in a flare, like the last thing I want to do is like have any type of stimulation at all, like
Yeah,
conversation. I don't want to do anything. And so I think when you're already feeling isolated and then you don't have any type of support system, we're gonna give a lot of great tools for that because
yeah,
it's so important. And it's part of the reason that we wanted to start this is because community, I mean, thank God for social media,
yeah.
because our community is big and we're worldwide.
Unfortunately,
But I think,
but
yeah,
fortunately, yeah,
but I mean, like when Misty and I first started talking years ago, when we were just kind of both were dealing with health issues separately, without naming your monster is important to kind of be like, okay, this is what I'm dealing with, and so
mm-hmm.
this is my, now I'm coming up with a plan of attack. Because for me, it's like not knowing what I'm dealing with. It's kind of like I don't know how to address it without really being able to call it something. So for me, it was
Yeah.
important to kind of get to that, like, what is it? What is it that's making me feel like not myself? Because I don't feel like myself, you know?
Yeah, I mean, I feel like we really, people like us truly have, I mean, we're like the best actors because, you know, so many times we got to wear a mask and, you know, the whole autopilot, like, you know, how are you today? Oh, I'm fine. And you
Yeah.
know, and that's just with most invisible illness, especially like mental health too. Um, you know, we're so used to just, you know, putting
Put
on
on
our
a brave face.
makeup and dress and putting our clothes on, going out the door and just like sucking it up, you know, for our family
Yep.
or our friends or community or for work to get through the day.
Right.
And people just they see you with that mask on, you know, and they don't realize like what's behind the curtain. They don't see you when you're in bed and when you're sick and all the time, you know. And so for me, when I started speaking up about my health issues, which has only been in the last couple of years,
Mm.
you know, I was quiet about most stuff except for, you know, when I had the flu or you know, a major like surgery or something.
Right.
But you know, because it, you know, trying to have a clientele and work a job, you know, people, I would not have clients, you know, if I told them how sick I was.
Right.
They would, you know, and that's when I started to, when I needed to cut back with work because of my health, that's when I felt
Right.
like, okay, it's okay if I do this now because I'm going to lose clients, but I'm okay with that because I need to.
Right.
And it's true, they just fell off, just dropping like flies, you know. And,
Right.
oh, hope you don't mind. I went to somebody else because I know you're always sick. And it's like, well, I still have bills whether I'm sick. And I still would show up because, like I had
Right.
to. I mean, there's
Right.
times where I leave the ER and go into
Go to
work the
work.
next day. Um,
Right.
so I mean, we really definitely put on a mask, and that's why I feel like for me it was important to just be like, you know what, this is how it is because
Right.
again, just awareness, raising awareness and education. The more we make people aware of all of these crazy things that we have going on, the
Right.
more, studies will happen, the more doctors will learn. I mean, even just having Ehlers-Danlos syndrome, I'm noticing more and more when I go to the ER or see different doctors, um, that they're starting to hear about it now
Right.
because, like people like me going in and bringing it up. I mean, um,
Right.
it just takes
It's
that
not just
one or
that
two
one thing they
people, yeah. And
read in
then
a
the
textbook.
next
That
patient,
one.
yeah, the next patient that comes in, then they're kind of like, oh, okay, I remember that. I heard about that, and it
Right.
really does slowly make a big difference.
Right.
Um, and even just like with family, I know like it will probably do episodes in the future too about just if you have a friend with an invisible illness or chronic health issues, just
Yeah.
things that would be helpful or not so
How to be there for
helpful.
them. How to be there for them.
um,
And that, you know, and I think that's important, because we obviously are both huge mental health advocates as well. And,
yeah,
you know, we are primarily talking about autoimmune disease, but mental health is just as important to both of us because
right.
it's got the same kind of stigma where it's like, don't talk about it, put on a mask, and I think the only way we're going to really be able to make any kind of real change is if we have a conversation,
Yeah.
you
And
know.
the other thing with mental health too, like I feel like anybody with chronic illness, mental health is gonna be
Mm.
an issue. Like it's gonna
Absolutely.
be a factor because when you feel like a prisoner to your own body,
Hmm.
it's depressing. When you're in constant
Absolutely.
pain all the time, it's depressing. When you're living in fear that you're going to have, a scary heart episode, I mean, it's stressful.
Right.
Um, you
You start
know,
not being able to keep your commitments to school or work or kids or
yeah.
spouses. I mean,
So it's really
yeah.
important to find that balance, not just like physically, but mentally too. But
Yeah.
yeah, we have
Yeah,
a
we've
lot
got
of awesome
we do.
topics, like
We
lists.
do.
My list is like that long in my phone.
I know. I know. I know.
And I
I'm
know
super
yours is
excited.
too. Yeah.
Yeah.
I hope
Yeah.
to interview some like authors too. There's a couple really good books that I've seen. So once we kind of get the ball rolling and have some shows up and we're like have a good flow going, we'll start trying to interview authors, and we'll probably
Right. Right.
look into interview some of our buddies on social media that we've met recently that have invisible illnesses that are kind of like the advocate for that
Yeah.
in their community, and maybe interview them so they can share more because um, there's a lot of stuff I feel like we don't know everything, so having other people come on to kind of
It's
teach,
community. Yeah,
that'll help
absolutely.
other people to learn. I even have a friend who has a service dog, and so like that's so
Awesome.
much knowledge and education that I knew nothing about that I'm starting to learn about. So I'm like, okay,
Right.
I'll save the rest of my questions for when we get you on the show.
Right.
um,
Right.
so I'm excited. We're going to have a lot of cool things to talk about that are going to help people, and hopefully we can make a change,
Yeah.
um,
And if you guys
whether big or small.
don't know, we're on social media. We're on Facebook, The Invisible Diaries. We're on Instagram, The Invisible Diaries, and we're just getting started. We're you know still in infancy, but if you're not following us, go follow us for sure because we're going to start posting and tying into our blog and stuff because we've got some really great themes and topics coming up for sure.
Yes,
So
yay. And oh, we are going to be
yay.
saying a disclaimer too for our
Yeah.
shows. Um, if you're good at
Absolutely.
that.
Yeah. Yeah. No, I mean, you guys have heard this spiel before. Like, this is strictly informational. for informational purposes only. Like, we're speaking from our experience, we're speaking on things that have worked for us. When other people are speaking, they're talking about things that have worked for them. It's in by no means meant for medical advice. It's not meant to diagnose, cure, treat, any of that. Everybody has to be, and if we can really stress that and emphasize that with this, project that we're doing, is that everybody is responsible for their own advocacy. You've got to be your own health advocate. So, we're going to have all kinds of, great topics and stuff on here, but really, making sure that you're talking to your medical team is going to be the most important thing. So,
yes.
Yeah.
And you can also, if you have any questions, you can also reach out to us. If you have any certain topics that you're like, I hope you talk about this, we'll definitely do that.
If there's something you want us to cover or something that you're interested in, or we've got a ton of resources between the two of us.
Yeah.
So
awesome.
If you don't know, we'll find somebody that does know.
Yay.
So that this is not 2 hours long. Yeah. High five. Woohoo. There we go.
It's good an hour. I think that's usually my rambling is usually about a good hour. So I'm pretty sure we hit that. But that's perfect.
This was our first time, so for sure. Yay.
All right, so I'm gonna stop recording, and then we are gonna figure this out, and eventually this is gonna be amazing.
It'll be much more formatted and professional.
Yeah. What she said. Yay.
Yay.
Bye. Do you want